I'm very excited to hear from Paul Loberti, who is a leader who directs the medical services from the Executive Office of Health and Human Services, to hear more about how they are working to also improve some of the outcomes and indicators that are impacting the people who live in our state, our Rhode Islanders and our neighbors. So, welcome, Paul.
Hello, everyone. Thank you so much, Kara. I appreciate that. It was very nice of you to introduce me in that manner. First gentleman, Andy Moffat, thank you very much for your support over the years, and of course, in absentia, Governor Gina Raimondo, all the efforts that both of you have done to really support vulnerable populations through the years has been well documented. Of course, Dr. Alexander Scott, thank you so much for all the things that you've been doing in the short time that you've been the director. Some marvelous things have occurred. And you mentioned some of them, and it's a testament to the selections that I think Governor Raimondo has made to ensure that all of us in Rhode Island can live safe and healthy lives. Also want to acknowledge Representative Diaz, Mayor Laws, who's about to come. And of course, Beth and Russ Millam for always being outstanding by displaying the quilts, and their dedicated service and compassion over the years that I've known them, and that's over 25 years. I can tell you right now, they'll run to an event and do whatever it takes to make sure that the visibility of the quilt and the people behind those quilts resonates with all of us. So oftentimes I like to say, you know, we should stop a moment and just reflect upon the individuals who have passed away. As the first gentleman mentioned, it's really critical for us to commemorate the day rather than celebrate the day. There's a little bit of melancholy associated with this for me after I've been celebrating them for probably 30 years or so. And I think that that's important to carry with us, even though there's been some marvelous advancements. So I ask you now just to take a couple of seconds to just bow our heads and remember those individuals that have passed from HIV. Thank you. I think as you were doing that, you probably remembered someone, or maybe more than one, as is the case in my situation. And for many years, when we formulated our community planning group, we would have an empty chair at the table that would symbolize the individuals that, at that time, were passing away too frequently, so frequently that we were visiting hospitals and nursing homes and funeral parlors at a pace that I just don't want to recollect. So today is really an opportunity for us to hang on to some hope, even though perhaps you felt things might be a little bit dismal over the past few weeks. I think it's important for me, the incurable optimist, to bring some hope back. And after all, it's a perfect place to do this in the governor's stateroom. So, without saying, World AIDS Day has always had a special meaning to me. And this year, I think you know that the U.S. themes are leadership, commitment, and impact. So from a Rhode Island perspective, I'd like to really tell you that it resonates with me, because those three words are really important to the Rhode Islanders in this room, and I know to the Rhode Islanders that I know that want to make Rhode Island always a great place to be. Of course, on the leadership front, and that's the first element of the theme, I'm proud that the state has a governor and a Secretary of Health and Human Services, Elizabeth Roberts, who couldn't be here today, and she offers her greetings, who have hit the matters associated with vulnerable populations head on. They do not shy away from a challenge and have always set the bar high for all of us. As a result, both of these incredible leaders have supported activities at the Executive Office of Health and Human Services, where I work, so that we have exceptional outcomes associated with care and treatment for people living with HIV. Commitment is the next theme, and that also resonates with me as a Rhode Islander. The Rhode Island spirit associated with commitment is related to the resiliency of the people who live here. Time and time again, you will hear from our Rhode Islanders, tried and true, that when we do something, we need to do it the Rhode Island way. Rhode Island is different, and we should be proud of that. Our fortitude and compassion stand strong and have contributed to a healthcare delivery system for people living with HIV that is among the best in the world. The best in the world. For those of you that work in the field, I thank you for your undying commitment and the achievements in clinical practice related to care and treatment. The commitment of case managers, clinicians, and a bevy of others who make care and treatment affordable, reliable, and quality-oriented is unsurpassed in Rhode Island. Next, let's talk about the next theme, which is impact. Over the many years I've been in this field, I've had the privilege of witnessing some unbelievable achievements in this battle. And yes, for those of you that are new to the field, we used to call it a war. And so you'll hear references every now and then to veterans or old people like myself that speak to this as a battle. Today we find there are more people living with HIV and AIDS in the state than ever before. The key word here is living, not dying. That's good news. In the first decade of the epidemic, we endured many, many deaths due to the inadequate treatments and the lack of accessible and available health care. Today, pharmacological interventions have increased the possibilities for people living with HIV so that they may achieve viral suppression. In the executive office, we're responsible for the care and treatment of people living with HIV. And more than 85% of those people living with HIV that are enrolled in the Rhode Island Ryan White program are virally suppressed. And that's due to the availability of and access to life-saving HIV medications. That, my friends, speaks to impact. In addition, we are so proud that more than 250 people living with HIV in Rhode Island were able to secure some form of health insurance due to the Patient Protection and Affordable Care Act. Many of my staff are here today.
Can we clap to that?
Many of my staff are here today that have worked tirelessly to offset some of the costs associated with HIV. Have you ever heard the words HIV poor? Well, in the beginning of the epidemic, AZT was probably about 50 cents a pill. So HIV poor wasn't really talked about much. But oftentimes it was talked about the victims of HIV because social determinants really did, as Dr. Nicole mentioned, dictate where you were going to end up. As the drugs got more expensive, there were certain things that occurred that became out of our control, and we wanted to bring it back. So do you know the cost of drugs in the state of Rhode Island now is about $25,000 a year? So while that's true, one major impact that we've done is we've decreased the number of people that require this full dollar assistance by creating premium assistance for them. And so our premium assistance program is really a godsend to those individuals who couldn't afford to maintain $25,000 a year in drugs. Who can? And so our Ryan White program really tries to offset any costs related to that concept, that horrible concept of not only living with a devastating disease, but being economically disabled by it. This was a great year. It was a year when Medicaid benefits were robust and stable for so many people living with HIV. And remember, again, prior to ACA, these individuals had no health insurance and are now able to access care as they need it. That's an incredible feat, and we see it every day. And I don't want you to underestimate the power that has had on people living with HIV, as well as people co-infected with hepatitis C. Of course, the Ryan White program is still going strong. And for those that don't qualify for Medicaid or can't afford health insurance, Ryan White is maintained as the safety net to keep people healthy and alive. Speaking of Ryan White, we have substantially expanded these services in 2016. For example, we increased the federal poverty level from 450% to 500%, making approximately 125 additional people to have access to our services. And other services have been expanded as well. As we look to the future, we're excited about keeping the 90-90-90 theme going forward and expect that the outcomes will align with those goals. The Ryan White program is excited to announce that we recently received a substantial award from HRSA, and a key focus of the grant is to initiate a highly specialized medication adherence and telehealth program. The program is called Virtual Nurse, and it will be the first clinically validated platform to help people living with HIV to learn the skills and self-efficiency to manage their disease and adhere to antiretroviral therapy. This activity will open up new practice methods for case management and really implore the notion of self-help among our patients. It may ultimately change the way our patients think about managing their health. By the way, if you haven't picked up a brochure that the team at John Snow so graciously did on our behalf at the executive office, please do so. Some of them are on your chairs. They talk about the accomplishments of the Ryan White program and some of the Medicaid components. I close with the reiteration of the theme set forth on this day. They're truly set up for Rhode Islanders. We can't lose. Leadership, commitment, impact. Thank you all for making Rhode Island a kind and gentle place for people living with HIV to live.
Thank you so much, Paul. I really appreciate that you use the term incurable optimist, because I have self-identified as a chronic optimist for a very long time. And so having a different way of looking at that or describing that is really helpful. It does sometimes feel like, despite a lot of things that happen, I can't stop being optimistic, so I'm going to keep going with it. And I think it is actually a very important quality to have, because it is with that optimism that you can continue to put effort into bringing people together, to continue putting effort into doing what you can do, which is absolutely important. Every single person in this room also has to have that commitment to having an impact themselves. So what each of us do, hopefully, is driven by an optimistic belief that we make an important difference in the world we live in.